Okay, well, good afternoon, everybody, and welcome to SACU's Africans Are Not Immune Town Hall. It's great to see you all here, and it's nice to see that we have quite a large representation of people who are on and people who are still joining. Before we get started, a little bit about SACU. So SACU is the Southern African Community USA organization. It is a nonprofit, a 501c3, that serves the Southern African diaspora in the DC area. It focuses on community building and outreach, as well as advocacy, education, and other community events, with a goal to unite and represent immigrants and expats from the SADC countries in Southern Africa, their families, and of course, friends of Southern Africa as well. Current board members include Nadine Guldino, Lisa Netta Zaivong, Mike Hove, Siringa Kachipande, Rachel Niete, Mimi Poland, Edie Sandale, Cassandra Sibada, and Omega Tawanezi. I'm your host, Toko Kachipande, and I'm a longtime supporter of SACU as well as member. I'm a career health and science communication specialist. Now, SACU is also supported by a board, advisory board of very talented community leaders as well. And I think we're all really happy to have the opportunity to discuss issues that are related to COVID-19 and Africans in the area as well as abroad. Now, so we're gathered here distantly to discuss these issues and how they're impacting Africans in the diaspora, as well as to discuss how Africans in this area are impacted, especially by the disease. As many of you know, the DC area region is one of the largest regions of Africans in the United States, with many working in the healthcare industry at the front lines of the epidemic, as doctors, nurses, people serving home and early aid cares, as well as other positions. And as on the news, we see many discussions about different health disparities and statistics that are affecting different populations. And those in the African community are usually overlooked and just grouped under African American. But Africans in the diaspora as immigrants, as well as Africans, do face special issues that are not accounted for statistically or really looked into. We do have unique social and economic factors that impact our community, like one being the belief that some hold that Africans are immune or that they might be a little more resistant to catching COVID, with people looking at the low infection rates in the African community. So we're here to discuss these issues and to talk about what's fact, what's fiction, and how we can address them. So before we get started, we're going to go over some house rules. This 1.5 hour webinar has 4 different sections. And after each section, we'll have an open discussion where those that are attending and participating will have the opportunity to ask questions. Those that are joining by phone only will also be given an opportunity to ask questions during that time. Zoom also does have a chat feature that you can access. And if you'd like, you can post your comments there as well. But once we have the open discussion, if you'd like to ask a question, we ask that you physically raise your hand so that we can call on you and mute you so that you can speak at that time. You can also virtually raise your hand by going to the bottom of the screen. It should say something like participants, and it'll open up a panel on the right. On the right, you see a couple of options. One of them are going to be 3 dots, a little breadcrumb thing. Click on that and you're going to see a hand. If you click on that hand, it's going to signify that you're raising your hand as well. So let's get started. We're going to start off with Dr. Mutsa Munjoma, who is an internist in Baltimore and was trained at George Washington University. She focuses on preventative care and serving underserved communities. She's going to start us off by talking about the virus itself, tell us facts and fictions, and just set us off by telling us about the coronavirus. Welcome, Dr. Munjoma.
Thank you. Yes, so I've been invited to talk to you guys about what is coronavirus, how is it spread, and what are the symptoms and things that you can do. So I just want to put a disclaimer that I am not a coronavirus expert, but I'm talking to you from the perspective of a primary care doctor serving an underserved community. And so I'm just going to speak to you about the things that we do and the advice we give our patients. So what is coronavirus? Coronavirus is it's actually a group of viruses that can infect both animals and human beings. The name corona is basically derived from how it looks under the microscope. It appears as a crown-like structure. And it causes coronaviruses can cause like different symptoms in human beings, from just a common cold to severe infections. COVID-19, which is what's been in the news, is a disease that's caused by coronavirus 2. And it's actually named SARS-CoV-2 because it is similar to the SARS virus in 2003. It's a new pathogen. And basically spread from person to person through infected droplets. So if someone coughs on you, sneezes, or in talking, so it has to land on your mouth or your eyes or your nose, and that's kind of how it gets introduced into your body. The droplets typically travel like 6 meters or 2 arm lengths or 2 meters, 6 feet or 2 arm lengths or 2 meters. So that's the whole social distancing with 6 meters away from 6 feet away, 6 feet away from someone. It is also thought that it is probably transmitted through infection or like touching an infected surface. That's actually not proven, but we do know that other coronaviruses, and it hasn't actually been studied in this particular coronavirus, but we do know that other coronaviruses can last on a surface for up to about 6 to 9 days. So disinfecting surfaces can come into that. The incubation period of coronavirus is about 14 days. Most people will exhibit symptoms about day 4 to 5. The symptoms range a lot. Most people have mild symptoms. 81% of people will have mild symptoms. 14% will have more severe symptoms requiring hospitalization, and then critically ill patients about 5%. Most of the time, it'll be a cough, fevers, body aches. It'll also be, in more severe cases, people develop shortness of breath. There have been some reported cases of a loss of smell, diarrhea in some instances. In really severe cases, people develop what we call ARDS, which is an acute respiratory distress syndrome. Patients in those instances require ventilation, also multi-organ failure. So in terms of the people who are at risk for getting coronavirus, what's known right now is that those people who are age 65 and older, people with cardiovascular disease, heart disease, hypertension, obesity, diabetes, cancer, HIV patients, people with chronic lung diseases. And we've seen in the news a lot of African Americans have coronavirus, but this is thought to be more to do with the social economic disparity, but all of this is yet to be fleshed out completely. The case fatality in general is about 2.3%. It's much higher when you look at an individual group, like say ages 70 to 79. Case fatality can go up to about 15%, and that's also dependent on the region and where you are in the world, that data. So if you suppose you think you may have coronavirus, so you're at home and you start coughing, you're not sure, the best thing you should do is call a primary care provider or a health provider to assist you with kind of walking through that. The CDC, I find, has a great resources for that. They actually have a little section where you can do a self-check. So it asks you where you are in the world, it asks you the state, then it'll ask you a series of questions. And that kind of is helpful for patients just to kind of gauge what they should do. But generally, you should really call a healthcare provider and seek help that way. Most of them, despite how things may look, most things can be handled at home. So most people have mild symptoms, so they can be managed at home. So you'll discuss your symptoms typically over the phone with your healthcare provider, and then they'll either just tell you whether you need to be tested, what you need to do. And as I said, in most cases, you can be managed with your healthcare provider at home. In terms of testing, it's getting better. So we have limited tests and also limited PPE. So which means we have to be very selective. So not everybody can get a test. They have become there are more testing sites now available, but it's really prioritized to those people who are high risk, to people who need hospitalization, for people who are healthcare workers. So depending on what the discussion is with your primary care doctor, you go from there. In Maryland, we have sites where you can get tested, which are drive-through, and those are through the state. That testing is for people who are, it's free, and that's for uninsured people can go there as well. There are other locations that are not that are for insured people, or if you want to go there, I guess. In those locations, those will be like your prompt care, your MedStar prompt care, University of Maryland, Hopkins. They have their own testing kits. The turnaround tests on the State Department, on the Maryland Health Department's, like the result comes back about 4 to 5 days after testing. And then when you're home and you're managing this at home, you should really be in contact with your primary care provider or whoever it is that you contacted, and they kind of monitor your disease severity at that time. So you need to check your temperature, watch for if you develop shortness of breath. If you worsen or deteriorate at home, then you would need to be managed in the hospital. A lot of times you need to also be able to isolate if you're going to stay home. So you need to be isolated from the people that you live with. So you need to have a specific room, make sure that you're washing and disinfecting things, that you wear a mask the whole time that you're home, and then kind of work together with your primary care at what point you can, because it's not known at what point you actually can leave the room or stop isolating. But generally we say 7 days from that's the guideline from the CDC, would be 7 days from the onset of symptoms, and 3 days with 72 hours with no use of any antipyretics, so nothing to lower your fever. And then at that time, then you can call your primary care and they can help you decide whether it's time to, whether it's okay for you to come out of isolation. And then again, the CDC has a lot of resources in terms of how to disinfect, what you can use, what products actually disinfect and what doesn't. Are there any questions?
Sorry, my mic was muted.
Sorry.
Thank you for that overview. Now, I know that there are some facts and fictions. There are lots of rumors that are floating around that you see on Facebook from different things, from drinking something like hot lemon water and people thinking that they can get chloroquine from wherever, some which are falsified medications, and thinking that that can help them. But, what can you tell us about the different rumors that are out there and what the actual facts are?
Okay, so in terms of, I think a big one is the hydroxychloroquine question. Sometimes you get patients calling, well, can I take that? So that is not an FDA-approved medication indication for coronavirus. So there isn't really a medication to treat coronavirus at this time. Now there's a small study that was done, but it was sort of like an anecdotal study. In other words, it wasn't a properly run controlled trial. We have ways in which we do randomized controlled trials in order to figure out whether something works or not. So at the moment, they use it sometimes in the hospital, but it's not a prescription that I was COVID positive, so I need a prescription for hydrochloroquine. It's not like indicated in that setting. Another thing is just to remember, sometimes people ask, can I take an antibiotic? It's not a bacterial infection, so antibiotics are not indicated for someone with COVID-19.
Sorry,
yes.
so it sounds like there is no cure.
Yes.
And there's no standard or known treatment. And I guess what they're treating right now is just the symptoms of COVID-19 to make people more comfortable and to get over. Is that correct?
Yes, that would be correct. It's just essentially supportive care in order to allow your own immune system to get over it. And any other co-infections that you might get while you are sick. But yeah.
Great. And so there's another rumor that within the African community, people are less susceptible to it. We talked about that a little bit at the start. What can you say about that?
I would say that is definitely, there's no data to support that. I'm not sure why. I guess it's probably because there's not as much coronavirus right now in Africa as far as we know. But I think that is probably unfounded, and we should probably just exercise precautions instead of thinking.
Okay, yeah, precaution is important. What would you say is the most important thing that people of the African community needs to know here? What would be your one big thing?
So I would say the biggest thing that I find, even I think you mentioned it in the beginning, that a lot of Africans are healthcare workers, whether they are GNAs, physicians, nurses, and so they are really exposed, right? So you have to be really cautious when you come home, that you don't transmit that to your family members. And so that means if you think you are exposed, I think you should wear a mask. I've had days where I feel like, I should really wear a mask when I get home. And I think being extra cautious with how you handle your laundry, disinfecting just light switches, places that you frequently touch, and being a little bit more hypervigilant when you get home so that you don't transmit that to family members and to other people.
Great. And I think right now for most of us in Maryland, you have to wear the masks, and that's also helpful in protecting those around you, including family members.
Mm-hmm.
Thank you. So let's open this up to discussion. If there are any questions for anybody who's online or any of the other panelists that want to jump in and add to what was said, you're welcome to unmute yourself, raise your hand. Let me just see who we have. And, okay, Dr. Barrie?
Jefferies?
Well, not doctor, just Fatmata.
Fatma Barrie.
I'm not a doctor. I'm an attorney. No doctors yet.
Yeah.
So question that I wanted to ask, and you sort of brought it up just now, Doctor. So we know that there's a high rate of fatality for African Americans by all reports. But something that I myself have been looking at personally is the fact that because our numbers are not really desegregated, and if it's a Black person, they just mark you under African American.
Right.
And since we have a high number, as you just said, of medical staff or healthcare professionals who are African, especially African nurses. I think I read somewhere 1 in 6 when they did a report back in 2013 or something like that. 1 in 6 nurses was African. And that's a very high number for such a low population of people within this country. So my concern is that in our community, we speak a lot about how the African American community is being impacted, but we're not really speaking on how the African community is being impacted. I know at least 2 or 3 people already who have died from coronavirus who are African, and they were back to back to back to back. And I'm sure there are others, because as we know in our culture, a lot of times we don't talk about these things. You don't tell, and you may find out later. But what can we do to sensitize people to be aware that those numbers that we see of quote unquote African Americans may actually include many who are African, especially if they're healthcare professionals?
I guess it's things like this increase awareness, right? Because I'm not sure how else, because you know when you put a diagnosis on a death certificate, or when the CDC or the health department reads that, like you said, they don't say, oh, this person was African, or you know, they just bunched into the same. I think just awareness within within the community is like this group is trying to do, just for people to be conscious of the fact that we're not immune, and that we need to take precautions, and to kind of, I'm not sure how else you would, like, I guess just awareness would be the biggest thing, right? To just make sure that people, even those who are not in the health field, so those who are, and I think particularly what I see is that occasionally I have like a nurse or a GNA where their parents live with them, right? And they're now sick. And when I ask, so what were you doing? Have you been taking precautions? I realized that they're getting home, they're doing precautions at work, but not at home, right? So it's like that education of saying you need to really be cautious. And I think that, to me, I feel like that's a big area of education that is required to make sure that people are actually being cautious when they get home.
So can we figure out a way, either with the doctor or SACU or whatnot, as the African immigrant community as a whole, because it's good to sensitize the community itself, but you hear a lot about who is being impacted and where the resources are going to affect those communities, to figure out a way to make sure that those who decide on where the resources go are also aware that those numbers that we keep talking about the Black community could also include us. And therefore, those resources should also be coming our way, kind of thing. But, you know, as a doctor, I'm sure you know a lot more than I do.
Yeah. I wouldn't know how to, that part is more like policy, right? I wouldn't know how to distribute those funds or how to give that to where it's supposed to go. But maybe someone.
Yeah, so maybe Dr. Jefferies, I know that you had raised your hand not too long ago. Maybe there's something that you can add to that. Unmute you.
Okay, I think, hello, can you hear me?
Yes, we can hear you.
Okay, I'm Dr. Stella Jefferies. I'm in primary care as well. I think I think that's a very valid point, that we need to be able to identify the Africans as well. And I think we have to reach out to the community, and each community leaders needs to be able to, I'm sure that we know the deaths, we know that those who are going to have funerals, and we can reach out to the community and tell, you know, because if my patient die and I write the certificate, I know that that patient, as the provider, that patient is African. I know that because I know my patients. So then we can reach out to the doctors, and the doctor reach out to the communities, you know, and let the community know, so that we can identify our people as well. And we should be able to get those resources coming to our community. So I think it's something that we can do as, you know, as Africans.
Great, thank you. And we're going to hear a little bit more from you, Dr. Jefferies, towards the end. Are there any questions on the phone? Does anyone have any questions that's on the phone?
I do have a question concerning testing. My patients, I'm also testing my patients at my clinic. I'm on the front line, and the first 2 patients that I tested came back positive. I put them home, send them home on quarantine for 14 days, and then after the 14 days, I did treat them. I treated them with zinc and erythromycin, and also vitamin C. Well, I sent them home for 14 days. One of the patients is a nurse, and she had to go back to work, and her job wants her to be clear. So what I did was I brought her back in. I brought her back in on Tuesday, retested her, and she is still positive. Both of those patients are still positive. So my question is to my colleagues, are you guys retesting patients? If we're sending patients to the community and to go back home, you're clear after 14 days, and those patients are still positive, then we're going to send them home to actually reinfect a lot of other people.
Testing is a really important issue. Could you also talk a little bit about, if somebody does think that they have the symptoms, you're told not to go to your physician, to call in instead, and you are told that there's a shortage of testing kits, not everybody can get tested. So if you do think that you might have the virus, how can you get tested? I saw something in the news the other day that talked about how CVS and Walgreens and some pharmacies might be opening up more drive-through testings. What should you do if you feel that you want to get tested?
Is that question related to me?
To both of you.
Okay, so what I do for my patients, and actually I'm testing both my patient and other patients in the community as well. We do order the test kit from Lab, from LabCorp, from Quest, and Acutis. So we have this patient come in based on their symptoms or based on exposure. So we have the patient come in and we get them. I'm testing every Tuesday at my clinic. After they test that, we give them a note to go home with the note saying that they should be quarantined until the test results comes back. And it is taking my practice 3 to 5 days to get the results back. So once the results comes back and it's positive, I will call the patient, do a Skype with them, and let them know that the result is positive and they should be on be on quarantine for 14 days, cannot go to work, and they have to be at home. And if they do have to at home, they need to try to wear a mask at home, and as much as possible so that they don't infect their family member as well. Most of my patients who's been coming to the clinic also have been symptomatic, so I've been treating those patients as well. I don't think it's fair that we say go home and get quarantined and there's no treatment for this patient. You have to treat the symptoms, because my goal is to get the virus from not getting to a patient's lungs, whether because they have infiltrates or pneumonia and they end up in the hospital on the ventilator. So I'm being as aggressive as possible to treat my patient. So once these patients are treated, I think it's fair to bring them back in and retest them. So as far as the testing centers, my clinic I'm testing on Tuesdays at my clinic. I know I was told the FedEx Center also has testing centers. There are other testing centers as well. Patient needs to go and try to, call their primary care providers. And I think all primary care providers should be testing. You just have to wear your proper PPE. You have to wear your N95. But it's unfair to send patients to the emergency room and the emergency and no, we're not testing. Nobody's testing. And you as a primary care, that is your job to test your patient and treat your patient.
Great. So it sounds like testing is pretty readily available. We can talk a little bit more about that later on, but we do have to move on so we cover all of the topics. And so thanks. We're going to bring in Lesley Kanjere. Lesley is a radiation therapist at Johns Hopkins Suburban Hospital and Deaconess at Forward in Faith Ministries. She and Dr. Munjoma are going to talk a little bit more about the healthcare systems and how to navigate funeral systems, at a time when there's a pandemic going on, and usually what is normal is not available, and it's the new normal. And how do you get things done when the steps that you usually take, that to take, are just not an option? So Lesley, start with you.
Hi everyone. Thank you, Toko. So my name is Lesley, and I'm just going to share my experience, how this COVID-19 situation has impacted my family. I know it has impacted a lot more people out there. So on the 21st of March, it was in the morning, I received a call from my nephew's roommate in New York saying that my nephew had passed away, I had passed out, and he had called an ambulance. So he gave me the information to the hospital that he had told them to take him. And I tried to call my nephew, he wasn't picking up. So, as a healthcare worker, I figured, with the commotion of being in the ambulance, getting in the emergency room and trying to get everything situated, he would give me a call later. Unfortunately, an hour and a half later, I received a call from the ER doctor, and he wanted a history about my nephew. And he said that he had gone into cardiac arrest. and they were trying to resuscitate him. And we all know, like, that the normal thing is to go wherever the hospital is. So I asked if he would come, and he said no, unfortunately they're not allowing any visitors. They were going to do whatever they can to resuscitate him, and they'll let me know. The only thing they could do was to communicate with me over the phone. So I called them an hour later, and they were like, oh, he's alive right now. We found a pulmonary embolism. We don't know how he got it, but we cannot operate. So we're going to try and dissolve the blood clot. But he's very critical. And so I asked again, can we come and see him? Since you're saying he's very critical. And they said, no, you won't be allowed to get into the hospital. We'll communicate with anything, any new developments. So that was like in the afternoon. And then later on, I tried to call them because, I was nervous, and I'm like, what's going on? Is he okay? I was trying to call my nephew's phone. He wasn't picking up. And finally, someone called me back around 11 p.m. and said that my nephew had passed away at 7 that night. However, still, we were not allowed to go there, and they asked if they could do an autopsy to find out, if there were any underlying conditions. So for those who are in the medical field, you know that like the autopsy is normally conducted by a medical examiner. So they took the body to the chief medical examiner's office in Queens, New York. And at the time, the COVID-19 situation was still a little better. So they told us that since you cannot come here, we can keep the body for 14 days. If you need an extension, or extend the time. So call us after 14 days, let us know, make sure you let us know if you need more time. So on the 13th day, I called them, and the situation with the COVID-19 had gotten worse. And they were getting rid of bodies as soon as possible. So I tried to ask, can we please have at least 5 more days? They were like, no, if you don't get your body by tomorrow, the bodies are going to be buried at the trenches. I'm sure most of you have been seeing how they are getting rid of bodies in New York, whether the person died from COVID-19 or whether it was any other causes. So then I started looking for funeral homes. And unfortunately, because of the critical situation of the pandemic, most funeral homes are no longer conducting funerals. They are no longer conducting burials. And at that time, there was a travel ban, an interstate travel ban. So we couldn't go to New York. And so I tried to have the body maybe shipped here to Maryland. That way, at least we could see if it's him, because since he passed away, we couldn't identify the body because they said we are no longer allowing anyone at the premises, and they are now doing like a fingerprint identification of the dead bodies. So only to find out that here in Maryland, they were no longer conducting funerals as well. They were either doing direct cremation, where they'll cremate the body with no family member, with no viewing, or they'll do a direct burial where they'll bury the body with no family member. And most of the funeral homes don't want to take pictures of the bodies, just, for the families to know that, this was our family member, or this is him for sure, it's our family member. So at the end, I finally got in touch with one funeral home in New York, and they agreed that they would take a picture. And so they arranged they picked up the body that Monday. They arranged a funeral. He was buried. unfortunately, we couldn't be there. You know, the normal thing is Africans or even most Americans, they'll do a body viewing, people gather. At that time, it was just me and my husband. A few of our Zimbabwean community friends came over, but most people were just calling, and it was really a hard time. So right now we are still waiting for the pictures, but we thank God that, you know, at least he got a burial of some sort. And when all this is done and over with, we'll be able to go and see where he was buried. So yeah, that's how this COVID-19 situation has affected my family, and I'm sure most other people out there who have their family members who are dying, whether they died from COVID-19, whether they did not die from COVID-19. That unfortunately, that's the situation that we are facing. And I just wanted to share my story, hoping, you know, someone somewhere will learn something about the impact of this COVID-19.
Thank you so much for sharing that. That's definitely a really hard situation to have to go through. And, you know, our condolences for your loss.
Thank you.
I know that you set up a GoFundMe fund for your nephew. And so those who are able to support that, we have the link to it on the SACU webpage. And you can also see it in the chat feature in Zoom right now. So I know there are a couple of raised hands and questions that have come in, but we're gonna move on to the next topic and then address questions for this and the next segment after that. And so definitely dealing with the healthcare system is a really hard thing, you know, at this point, because you can't pick up the phone or drive somewhere, you know, as you spoke about. And we're going to talk a little bit about more about the healthcare system, because we do have lots of Africans, Southern Africans in the US that work in healthcare as doctors, nurses, home aides, tech staff, and others. And, you know, they do put themselves at risk by being on the front line. And so we're going to talk with Opper Chiweshe, and she's going to talk a little bit about her work and how she's navigating working during COVID-19. She's a nurse with over 20 years of experience, and she's also the founder and president of the Zimbabwean Nurses Association of America. Opper, welcome.
Thank you, Toko, for that introduction. Can you hear me?
Yes, we can hear you.
Okay, great. Okay, so like you said, I really have the privilege and pleasure of working with a lot of nurses in my line of work, as well as with a group that we formed recently, the Zimbabwe Nurses Association. So I'm going to talk through, for my segment, I'm going to take you through a day in the life of a nurse, and just so you understand what dynamics we are going through. Okay, so it's 5 o'clock, might be AM or PM, depending on what shift you work. Your alarm goes off. You wake up and get ready for work. Your morning prayers have become more intentional in light of the invisible monster. You say a prayer for your family that's staying home while you are at work, hoping that the kids won't go out to play at the playground, despite you telling them not to. You plead the blood of Jesus over family and friends across the world. As you get ready, you pay particular attention to things that you never really paid attention to in the past. Do you wear a pair of tights and a vest under your scrubs, just in case you have to strip out of your contaminated scrubs at the end of the day before you get back to home to your family? You bid your family goodbye and head out to work. There's a little silver lining there, because thanks to all the people staying home, hopefully your commute time has been cut in half or so. So you arrive at work and you're subjected to screening, just in case you have a temperature, but you're here to help the sick. You wear a mask just in case you didn't have one. And now we are required to work a surgical type of mask in the hospital. You could be assigned to an all COVID patient unit. Now, these are the units where patients are isolated into, and some of them are sicker than what you are normally used to. They could be patients that are on ventilators. And yes, some nurses who are not experienced to working with patients with ventilators are being assigned to those units because there's a shortage of nurses. Some are out sick and some are on quarantine. You might even know a colleague who is struggling and fighting for their life because of this sickness. And then every day you are faced with updates as you come to work. What is the latest? What is the newest in combating COVID-19? We are now repurposing masks. Repurposing entails re-sterilizing or sterilizing masks because they are not sterile to begin with, but they are being taken through to the sterilizing department to re-sterilizing them. And then you have to reuse it because of the looming shortage of the PPE. Sometimes you are allowed to wear a headscarf. Some places don't allow you to. You have no idea. There's so many updates that keep coming out of the CDC, and each day you come in, there might be a difference from what you were doing the previous day. It's all confusing and all scary. But you are a professional. You have dedicated and committed your life to sharing, to caring and comforting all of your patients. Yet at this moment, you are also deathly scared of a possible breach in your own protective gear that might put you at risk of contracting the disease. As you enter your patient's room, you are the only connection, the human connection that they have. They are alone in the room, and like the discussions were going, mostly it is the critically ill patients that are staying in the hospital. If you are not too sick, they will send you home. If you need a couple liters of oxygen, people are being sent home on that. So the ones who are staying in the hospital are sick. Yes, we have these platforms of video chatting, but these patients might be so sick that they cannot even handle to be on a video chat with their family. So you are it. You are scared, they are scared. You have to be strong for the both of them. You go through your whole day being the best you can to your patients, and you are also a support, or really the main person. You are watching out for your team, the doctors, the nursing assistants, the housekeeping, the dietary people, to make sure that they are also dressed and properly protected as they help you through everything you have to do for your patients. Okay, at the end of the day, thank goodness you are throughout the day, there's a roller coaster of emotions. I mean, no doubt, you have patients who are making it, who are getting better, and you have patients who are not getting any better. And then finally, your shift is over and you prepare to leave. You go through another ritual of making sure to take off all your protective gear without contaminating yourself. God forbid, you're going home to your family. On your way home, you have emotions reeling in your head. Did I do everything I could for these patients? What about that patient who didn't make it? You heard from Lesley. What is the family going to do? You are the person. You are going to put yourself in their shoes and wonder, how are they dealing with this loss and the tragedy during the lockdown? But again, you are going to your family, and again, you start thinking about your family who is back home. We all know the healthcare systems in our homes is not the most ideal. You think about those things that are being shared. Do you send them that WhatsApp message that talks about lemons and garlic and onion and all that stuff, just in case something will be helpful? Who knows? I mean, you are just as scared as everybody else. You get home, you make sure that your clothes, you take off your clothes, you wash up, you do everything you can to avoid contaminating your family. But they are looking at you. They have no idea what your day has been. If you are a father or a mother, they still expect you to be in that role. And they are oblivious to all your internal struggles. So then this is just I just wanted to make sure that this is just a typical day for a person who is who is a nurse in a hospital. There are different other settings that healthcare frontlines are working in. We have nurses working in the psych units. I'm sorry, yeah, even our psych patients, they are not immune to these diseases, to the disease of COVID. And they have to be handled, sometimes physical handling when they start to go out of, whatever their behavior is, depending on their illnesses. We have nursing home caregivers. We have people who go into home health, into other people's homes. We have private duty nurses. We have caregivers all over the place who are putting themselves into harm's way. When you get home, you start thinking, what does my neighbor think? Do they see me as the hero that we all see on Facebook when people are being showered with praises and they see parcels being left at their door? Or they are looking at you with that suspicious eye thinking you are the one that's going to bring the COVID into our community. And all these are the scares that every day you go through and you ask yourself, did I do all that I can to protect myself, to protect my family? How does the community look at me, like I just said? And does anyone understand all that I'm taking in and all the emotional burdens that I am taking in caring for the patients? So this is what I leave with you, with just that snippet. I hope it makes you reflect on what is your own attitude towards healthcare workers or frontline workers during this pandemic. Thank you.
Great. Thank you so much, Opper. That's definitely, it definitely for me makes me very appreciative of healthcare workers. I want to say thank you to you for protecting all of us and the sacrifice that you're taking to keep us all safe. It's definitely not unnoticed. And I can definitely see how emotionally straining and stressful that must be, especially if you have little ones that are at home. And a lot of us also take care of older parents or aunts and uncles and so forth as part of our community. We have lots of questions that are coming in for you through the chat, but we're going to address them all at once. So we're going to move on to talk to Dr. Stem Mahlatini, who's going to talk about the stress and the mental health issues that come with, people like you who are on the front lines, as well as, your family members and everybody else who is now in this new world and this new way of living. So Dr. Stem Mahlatini, Dr. Stem, as she's often known, is a licensed psychotherapist of Zimbabwean origin. And, Dr. Stem, what do we need to know about mental health issues within the community during COVID-19 times?
Thank you. Before I start, I just wanted to say thank you to the board members and everyone who's on the Southern African community for allowing us to have this much needed platform and discussion. So thank you to all. And Opper, I would not have put it in a better way to, show a picture of what, our healthcare workers and people that are in the front lines are going through. So I also want to say thank you to you and all the doctors and everyone that's on this platform and the ones that will be listening in. Thank you for what you're doing and thank you for the sacrifice. It is scary. I tell you, I was listening to you and I don't know about everybody that's on there. My eyes were just teary and I was just going, wow. That is the stress and anxiety that everyone is going through. The one that we just had from Opper was from the healthcare, workers' perspective. But for us at home, I'm a therapist, I'm a mental health therapist. So what has happened is all of us are now working and doing sessions this way on video. And we also do some on, telephone, talking to people, and people are scared. So I'm here to talk to you about the mental health aspect of this whole thing. If we have never been so open to talk about mental health and that it also affects us, it's almost like I also want us to have a town hall that we say, Africans are not immune to mental health, so that we can just have mental health talk alone, because that's also has been a taboo for us to talk about anxiety, to talk about depression and, panic attacks. And those are real. People are anxious. Anxious meaning they're worried, they're overly, excessively worried. And why are we worried? It's normal for us to be worried. There's no specific testing that has been determined for us to all have, go to a doctor and say, we're getting tests. There's a shortage of tests, as the doctor said earlier on. So everyone is worried. So if I start coughing and I have a temperature, what am I going to do? there is that fear, and it's real fear. However, if we listen to what the doctors, have said, it's not, critical for everyone to get that tested. So that should at least, calm us down. So what happens is all the doctors, most of them that are outpatient, are also doing telehealth this way, where you'll be able, in the comfort of your home, call a doctor and they talk to you about the symptoms that you're going through. I know many people don't have insurances in some states that are there. I understand that. That's why the CDC, they have put the symptoms that you might look at and see, these probably, normal symptoms that anybody who's positive might exhibit. And then these are the ones that are excessive that I need to call a doctor no matter what, to call the emergency room and ask them. If you call the emergency rooms, they also have in most areas doctors that are doing telehealth from the emergency room without you having gone into the emergency rooms. So I would even, make those phone calls if you see yourself, feeling the symptoms that are listed on the CDC. And I'm hoping that, probably what we'll do is to have a list of those symptoms as a download or something on the website, Southern African Community website under this, because with mental health, when you know how to handle situations, you relax a little better, you do a little better when you have the information. So what we want to make sure is everybody has the information that they need. I have talked to people that say, well, when I test positive and I have to sit in my room, I have younger kids, I don't know how to tell them not to come near me. And, it's almost like my heart breaks. Let me tell you, the reason why we are saying we are not immune, I would rather your heart break from not having your child come to you and contaminate, this, disastrous virus that we have now, and have other people that are in the house take care of them, than you risking the fact that you can't bear your child crying and saying, I want to see mommy, I want to see, dad. So the first thing that I want to also say to people is for us to allow ourselves to understand that this is serious and it is affecting all of us. So we all need to take the precautions that we're being told of washing our hands. Yes, we look ridiculous in some of those masks. People are like, oh my God, I look ridiculous. But then guess what? We would rather look ridiculous and be safe. The gloves that we're supposed to be wearing, we would rather look ridiculous wearing those gloves than not, be safe. Unfortunately, there are people that we have lost, and to my sister who was here earlier on, my condolences about your loss. There are a lot of us that have lost loved ones due to this coronavirus, which is again an indication and reminder that we need to be serious and take care of ourselves. You also want to have the courage to ask for help. You also want to have the courage to you put yourself out there as a person, that is in need of services in your community, if you need the services in your community. Because what's happening is a lot of mental health, which is the stress, people becoming depressed and panicking, is because they don't have enough food in the house, or they don't have enough resources. And I think on this panel, we have another speaker that's coming in and talking about those resources. If you see them listed, please ask for that help and take care of yourself. If you're a person that already has been diagnosed with a mental health, depression, anxiety, schizophrenia, or post-traumatic stress, or any other diagnosis that you have, out there, what you will experience is you will find that you might be having those symptoms even more now because of the anxiety, about the COVID that's going on. Do not hesitate to call your doctors so that they can take a look at your medications. And as I said, therapists are now available online, so you can talk to a therapist to continue your counseling sessions, online. There was a question about what is being provided for people that are on the front lines, or families, as far as mental health services. There's a program for those of you that have been furloughed at home, or if you had a job. There is a program for each company, each hospital, that they have. It's called EAP, Employee Assistance Program. What that number is, you get it from the Human Resources Department, of your company, or you get it from a manager or a supervisor. I've also realized that a lot of supervisors and managers actually don't even know that number. That's okay if they don't. If they don't know it, then go ahead and call the human resources. They have an 800 number that you can call. When you call that 800 number, ask them for free EAP sessions to talk to someone. Here's the key. Do not tell them when you call that, you know what, I want to talk to them about stress. I want to talk to them about, you know, the anxiety that I'm going through, because you get free sessions per problem. So if you call, let's say you call today and you say, I want, you know, free sessions for stress. Just say, I want free sessions for stress for myself. So you get 5 to 25 free sessions to talk to somebody like myself or other mental health providers that are out there, and you get it for free. And then you get one for your husband, you know, fiance, boyfriend, partner, significant other. You get another free to 25 sessions. And then you want one that you want to work as a couple, that's a whole different 5 free sessions. Then you have a child that you have in there, or you want your children to be able to talk to a therapist as well, you get different free sessions. So don't mix them up, because a lot of people are not aware of that information, that it's per problem, and then you also get it per family member can get their own free sessions. So many organizations have put that in place, that their employees can get that free session. If it's not, you know, that you're not working and you don't have access, you know, to that, many of us are either giving out, you know, a portion of free services, or, you know, a very discount for many therapists that are giving out their sessions at a discount to accommodate people that are in need of emergencies, 1 or 2 sessions that can just help them relax or help them with resources or putting things together. So that's another resource that, you know, I wanted to talk about. It's important about the thinking, and I know that I'm putting a lot of information, you know, within 5 minutes, but because there's a lot of stuff that we were talking about, and I was talking to the committee earlier on when we were planning that we probably might want to, even each section that is here today will need to be expanded and just give it a whole hour so we can interact with all of you, answer some questions, and, you know, get to talk about this. But the thinking, I think what's really worse is the way that our minds are taking us to places that are unimaginable. So I urge you to limit the news that you're watching, to limit the television, you know, shows. And I know you want the updates, but what's happening is you're getting what we're calling vicarious trauma, because you're watching, you know, the deaths and, you know, I mean, the commotion that's continuing day in and day out. And that's information overload on your mind. For mental health, it's not a good thing. So give yourself breaks where you can say, I watch the news maybe for 30 minutes in the morning just to see what the day, you know, is like, and then shut the TV. And then watch it at night, just watch the news to, you know, for the day, and then, you know, shut the TV. Anxiety is contagious. If you're a parent, a partner, an employee or someone, and you are anxious yourself, it is catchy for other people around you. So when you choose not to get those news or not to watch the news, and, you know, limit yourself to the people that also talk about this all the time, and not finding other things that you can talk, it is contagious and it is not a good thing for you to do. So I hope that, you know, this quick, you know, overview will be helpful. But ask me any questions. I'm still here to answer your questions as well.
Thank you, Dr. Stem. And I completely agree with you that this needs to be its own town hall and its own 1 hour session, because you shared so many good tips and information in there, especially about the news. I think often the little young ones, they might not be watching the news, but they hear, you know, and they pick up on all of that. And I think there's the stress that they're picking up as well that we need to pay attention to. But so much to digest. If you're interested in learning more about Dr. Stem, if you go to the chat, her website is on there. She also has a Facebook support group and a new book called 7 Steps to Coping with the New Normal that I think that deals with fear and anxiety, correct? And would probably be helpful for a lot of people.
And that's a free book, by the way. That book is free.
Oh, okay, even better. And it can be downloaded from online, correct?
Yes.
All right, so we're moving a little short on time, but we want to jump on to the open discussion for people who have questions to ask. And Harriet, I see that your hand has been up for a while, so do you want to start us off with your question? She might not be on anymore. Let's see, let me see, other questions that came up for the last 3 sessions. Somebody asked if there's a support group for Africans to go to as far as African nurses, and maybe even for mental health. Do either of you have any suggestions? If not, we should start one.
We do need to start one.
Opper, do you know of any support group for African nurses?
Sorry, I was trying to unmute myself. And so I think, like you all say, this is an opportunity, if not any other time. This is a great time to start something like that. We have a small group, like we said, we are in a small group of nurses from Zimbabwe, and we have been doing this very similar type of meetings where we do virtual meetings, where we debrief and talk to each other about the stresses that we are going through. Granted, we don't have a mental health specialist like Dr. Stem, but we do have other nurses that work in mental health, and we have it's just been really helpful to be able to talk to like-minded people. So yeah, just on that part, we do have that little group, but I guess we could expand and do a bigger group that involves the whole region.
Absolutely, that would be great. We haven't paid attention to anyone who's on the phone. Does anybody on the phone have any questions? Doesn't sound like it. So we addressed a lot of things in the last couple of minutes, including how to navigate the home health care service and things like funerals as well. Any thoughts from anyone on that? Well, Lesley, is there anything more that you would like to share?
Oh, I think I already shared on the chat. Someone was asking for more testing centers. And for those who are in Montgomery County and near the Bethesda area, I know Suburban Hospital is a drive-through testing site, but you need a prescription from your primary care. So I think, was it Dr. Mutsa who said that make sure you call your primary care first and ask for that prescription, and then you can go to the drive-through. And as most of you have heard that the government has said that the COVID-19 patients are going to be treated for free. It might not be true for some hospitals, but I do know that at Suburban Hospital and most of the Hopkins Hospital actually are taking patients, and they are not sending out bills right now. So if you do have symptoms, please don't hesitate to go and get tested.
Great, thank you for that. And just a reminder, if you're on the phone, you have to unmute yourself before you can be heard. So if you were trying to ask a question, we couldn't hear you. But we're a little short on time, so we're gonna move on. We'll have another opportunity to ask questions at the end. And we're gonna bring Dr. Stella Jefferies back to us. Stella, she's an adult nurse, Stella Jefferies. She's an adult nurse practitioner and a graduate of Catholic University. She is passionate about health education and has participated in a number of medical missions domestically within the US and internationally as well. So the pandemic is spreading in most African countries right now. And I think we want to get an understanding of what is going on abroad, how are governments there dealing with the pandemic right now, and how are hospitals that are already in fragile healthcare systems, how are they expected to deal with this, as well as physicians that, have economic shortages, like not as much access as you might get to PPE and medications, where in this country, we're already challenged with getting, adequate medication for treating some of the symptoms, as well as for healthcare practitioners to protect themselves.
Okay, thanks, Panna, for allowing me to come on today. My name is Dr. Stella Jefferies, as she stated. So today my focus will be on the coronavirus, how it's affecting Africa and the African diaspora, the reaction, the response, the impact of COVID-19 as it's reaching the continent in light of global inequality. This pandemic is widening the social and economic division, which has also made the virus even deadlier. As of today, according to the Africa CDC, there is 20,270 cases, 1,025 deaths, 4,700 recovery. So this is a very challenging time within our community. Our government's in a very African country. There's lack of resources, supplies for hospital, medical professional in Africa. The pandemic will continue to impact Africa in terms of socioeconomic inequalities. But as a diaspora, African diaspora, we must come together collectively to support our African countries. As far as the various African countries, I'm gonna speak for my country, which is Liberia. For right now, where we, the diaspora, have put together a task force where we are working with the health department, Dr. Jala, the health minister, and we're trying to give resources to support that country, my country, Liberia, because as you guys all know, Liberia recently went through the Ebola, which was devastating for the country, and now to have COVID-19, it's going to be even more detrimental. So we're trying to do our best. I know there's the Africa CDC is working with the different health ministers in the various countries to provide resources, supplies. So as far as that, I think the different countries would need to work with Africa CDC. I know I was told that China is also China has also come forth to assist Africa as well. So, but I want to challenge us as African in the diaspora to be the one to also help each of our countries. I'm very, very glad to hear that the Zimbabwe Nurse Association, I think every association, every African country in the diaspora should have an association that will be able to provide resources to help their countries back home. This is not the time for us to sit down and do nothing. It's time for us to mobilize ourselves within the diaspora and work with the leaders. Don't do it in isolation. Contact your health minister and ask them what is it that they need. Because right now, even within the United States, we're scrambling for supplies. Italy is scrambling for supplies. There are lack of supplies. There are lack of resources. But I know we can all come together. What we're also doing, we're trying to also invest into the locals in Liberia. Those who are able to make the masks, those who are able to make the equipments. Right now, we need 100 beds. We have 2 tents. When we have 1 COVID center, we need to open 2 other COVID centers. So we work with the health department to be able to provide those resources to the country. Again, and I'm sure the CDC, the Africa CDC, not the regular CDC, not the US CDC, but the Africa CDC is working with the various African countries to try to help with the resources, because there's a lot of inequalities right now. Because I'm sure Africa will always try to put Africa to give the last support, the last supplies too. But even the great United States don't even have the supplies, don't even have the resources. So I think it's so imperative that we as a diaspora come together as a community to help our various African country. And also I know that Dr. Arikana is working also with the diaspora here. So if you can go online and contribute to that, donate to that. She also is making a lot of changes to help Africa at this time with the COVID-19. So we need to all come together and try to help, because if we don't, Africa, especially my country, Liberia, it's just gonna be very devastating because we just got through Ebola. Now we have to go through COVID-19, and it's so sad for the locals who are in that country. They're going through a lot of distress, a lot of stress right now, and the healthcare workers, they're complaining they don't even have supplies. So there's the good thing is that COVID-19 is not on a scale that is in the United States. We don't have that on the same scale. So our goal is to try to contain it, try to do a lot of health promotion, so that we don't get to the rate where it's going within the United States or Italy or even China. So we have to do our best right now to try to continue, try to eliminate, do a lot of promotion as far as health promotion, the hand washing, the social distancing, as far as quarantining those who are sick so that it won't spread within the communities. But as far as the inequalities, if we in the diaspora don't come together, it's gonna be pretty bad for Africa, because right now I don't see the resource. I don't see the NGOs going into Africa. I don't see the USAID, because they also need help right now. So even as recent, I got a call to go to New York because the help is so great, it's needed. So we all need to try to come together and work for Africa.
Thank you for that. And I think it's a really good point that you bring out, and that people who are here can help people who are abroad by going to places like your embassies and talking to them about what they're doing and how can they, like what the government is doing, and how can, I don't know, how can we help develop additional masks? As you see, people in different areas are creating masks as they can. You know, they might not be the N95 ones, but they're the ones that will help when there are no resources available. And I think you're right. At this point, at a time when the West is bidding on things that are in shortage, Africa is going to get outbidded because economically we are not that strong. And I think your country might be better suited to handle this since they went through an Ebola crisis. But for other countries like mine, like Malawi, this is something new. And I think that getting people in the mindset of how to respond has been a little challenging. So what do we tell fellow Africans who are at home who may not think that wearing a mask matters, or who may not think that being quarantined is something that's important? You know, what suggestions do you have on that?
Well, I think it's important to try to reach the people in a different dialects, in a different languages, and try to reach, you know, the common Africans. Try to reach them in the, you know, where they're at. And the basic is starting with the basic, you know, just education. Let, you know, do a lot of health promotion, a lot of education, and educating and talking to them. And each family member can talk to their loved ones and say, you know what, especially those who are in the diaspora, call your family members and talk to them. Let them know what is going on. Let the next person talk to the next person. You know, a lot of getting this information out would be the best thing right now, because I know even as of now, Africa thinks that, no, this is not true. This a hoax. Then the government is trying to, you know, is trying to get out. In my country, they say no, they don't believe what is going on. It's the government trying to get money out of them. So we have to continue to just keep educating the best we can. You know, let's talk about the hand washing, talk about the social distancing, where even if you just have a scarf, cover your face, because just by talking to a person, the virus can transfer. By coughing and sneezing, the virus can transfer. So just the basic thing. If you're gonna cough into your shirt. Don't just cough into the air. So those are things that the basic education, but we have to get the education to the various part of the countries, not just in the cities, but we got to go in the interiors, go in the various part of the countries to educate the people about the virus, how to prevent your family from getting infected with the virus.
Absolutely. And I think within our community here, there are many people who work in different industries, either, you know, working for organizations like the World Bank or some pharmaceutical company that, you know, might have a program that's available to help people develop drugs in different areas. And I do think that we need to think, you know, that way on a larger scale as well, about how, you know, we can help. There's something, it might seem like it's something little, but we all can do something. You know, I'm thinking about the chloroquine issues and a couple of stories that have come out in Nigeria and Cameroon about people selling fake chloroquine, or people taking it and dying. And I think those are the important messages that we have to get out there, but also it's how can we work with our government regulators, you know, to get them to address the supply chain issues that exist, and to get them to stop the existence of things like fake and falsified or substandard medication that's hurting more people than it is helping. And I think that we have a lot of people on the panel that are from different countries. So let's open the discussion up, you know, so people can talk about, you know, what's going on in their countries, and, you know, where people can find avenues to help and who to contact and what to do. I see that we have Dr. Munjoma, you have your hand raised. Would you like to go ahead and start?
Yeah, I was just going to kind of reiterate what Dr. Jefferies said. And I think it's really, especially in Africa where we have such limited resources. And I think it applies here even. If we just remember that 8% of these people aren't actually that sick. So controlling spread is really key, right? So it's not magic, right? So you can use the hands, a scarf, not coughing out, making sure that you cover your mouth, cough into your elbow, washing your hands. So those things are, the education of those things are really critical, because that really does do a lot to prevent spread, right? I mean, if the stats are true and only 80% of people have mild symptoms, then you could really do a lot to squash it, especially in a place where you don't have resources. So I think it's educating your people about that is really, really important. What do you do if you do feel sick? if you feel like you have symptoms, stay, try to isolate, even, as much as you can. I just I think that's, other than just also, obviously contributing to send masks, and we have issues with ventilations and not having well-equipped hospitals. But I feel like that's a huge piece for, particularly in Africa, where the resources are so limited.
Yeah, the primary prevention is the key right now.
Yeah.
Yeah, or even something like encouraging, we have a lot of tailors at home, at least in Malawi, or even something like encouraging them to make masks that can be passed around in the community, because we do have those resources there. And I'm looking at one question that came through chat, and somebody's asking if you think that asking people to wear masks gives people a full sense of security because they're not getting the hospital grade masks.
No, even the Surgeon General for the United States came on and stated that even if you can get your bandana and make it into a face covering, it's very, very key to cover your face. So I would say no, it is not a fuss in the security. It is very important. It's very imperative to cover your face, because even by talking to a person, the virus can transfer. By coughing, it can transfer. So your face covering will be some protection.
Mm-hmm. Absolutely. We have so many questions on this, but again, we're short on time, so we're just going to move it towards the end, and then we're going to give people an opportunity once we've gone through the next two sections. It's for the doctors especially, and everybody else who's spoken, if you're able to stay online just a little bit longer so we can go through some of the items that people want to discuss. But we want to talk a little bit about immigration. A lot of Africans in the area are, either visa holders, international students, or documented or undocumented residents that face additional challenges during COVID because they don't have, all the rights that Americans might have, or the freedom to move around or even visit people at home, or they just might be in a legal situation that's kind of looming out there. So we're going to talk to Fatmata Barrie, and Fatmata is an attorney in the Silver Spring, Maryland area. She practices immigration law as well as special education law. Fatmata, what can you tell us about, the things that you're seeing and legal challenges that people might be facing at this time that are on top of their usual legal challenges?
I think probably one of the greatest things is the concern people have. So there are people who have applied for asylum and they're not getting their dates. So they're concerned that maybe the application has been denied or that they're not working on it. So I've gotten calls about that. I've gotten calls about people who came here to visit and then this happened. So now they're sort of stuck, right? And then you have people who have benefits that they want to apply for, but they're hearing that USCIS is not working right now. So some of these questions I will sort of answer a little bit and go over. So USCIS did shut down partly in March 18th, and it was mainly for face-to-face interviews and things like that. So they closed down some of their support centers. For a little bit, some were still operating, but generally that's what they've done. So what I'll do is after this, I will send links to places where people can go to find out where their offices are, if they're open or not, and when they're gonna be open, and so on and so forth. So if you are here visiting and your visa has not expired, or your stay hasn't expired, you can file for an extension because of the situation we're in. And maybe it's not feasible for you to go home and you're not able to go home. So you can file for an extension. If you received what's called a request for evidence, so say you file for some benefit and they send you a letter saying they need more information, that's the request for evidence. So usually they give you a certain period of time for you to respond. So because of this, if you received your notice between March the 1st until between then and May the 1st, then you have about 60 days, within 60 days of when you're supposed to have responded, for them to look at it still. And same thing with what's called notice of intent to deny. So they, call it the NOID. So notice of intent to deny is where you file, and they send you a notice saying, well, because of reason A, B, C, and D, we intend to deny your application for whatever. So if you received that and the decision, and they say, the decision is going to be made and so on and so forth, usually they give you a timeline when you can appeal that those decisions. So they are extending that. And with the extension, again, it's another 60 days for you to get the opportunity to respond to those notices that USCIS is sending you. They're also giving you an opportunity to prepare also really for your asylum hearing, right? So I know there are people who have dates, and those have probably been canceled. If you have not yet received your notice, you should be receiving your notice pretty soon. And the cancellation will then give you a new date. I know at least a couple who they're supposed to have gotten their appointment done at the end of April. Now it's been moved to 2021. So you may not even come back around until another year later. The unfortunate part is people who have applied for citizenship. And so now they're delayed. They cannot swear in. So if you can't swear in, you're not a US citizen, so you're stuck. So that's the unfortunate part of all this. So it sort of put people in a limbo, and it makes some people stressed out because at the end of the day, they're not moving forward. Whatever this they filed is just sitting there. So if you have an application pending, it's supposed to still be worked on because they're not closed. It's just the face-to-face meeting that are canceled. So they're not allowing outside people to come into the buildings. That's about it. So if you have a work permit that needs to be extended, you apply for it. What they're doing now is they're using your previous biometrics for now. So instead of you having to go in to redo your biometrics, your fingerprint and pictures and all that, they're going to use your previous biometrics. So if you have a application to file in order to get a new work permit or renew your work permit, do it and send it in. If you have any sort of benefit, immigration benefit that you could possibly get, either it be your DACA application, file for it. Go ahead and put your application for your DACA. Go ahead and put your application in for your green card if you have an opportunity for benefit. Whatever it is, put it in. I suggest people speak to an attorney because if at a minimum, get a consultation, get an idea, pay your whatever, couple of $100, $300, different attorneys charge different things. Do your consult. If you don't feel comfortable hiring somebody or you don't think you can afford to hire somebody, that's fine. But ask all your possible questions that you could possibly ask, because at this time, things are sort of in a limbo and they're stuck. We still have people in detention. So I've had people who are like, oh, my family member is in detention. Are they going to release them? As far as we know, not yet. So they've talked about releasing people from the jails and whatnot, but we haven't heard yet about detained immigrants. So as far as we know, people are still detained. And part of also the information questions I've gotten, because we have a lot of people in Europe, in England. So for visa waivers, what they're doing is they're giving you 30 days to kind of get get things in order, because there's no, because visa waivers are not visas. So you can come in from certain countries like the UK and Canada. That's not a visa that you have to reapply for, to extend, and so on and so forth. It's something different. So for those who have it, they're giving you a 30-day extension to get that done, to satisfy your removal or your departure from the country. So you can if you're supposed to have left, you have 30 days from that date to leave. So I think that's majority of what I wanted to talk to people about. But you can still, again, the major part is you can still apply for your immigration status. It's not over. They may announce all the closures or the closures are just for face-to-face. So if anyone has any questions, you can ask me. And if I think of anything else, I'll let you know while we go through everything else, okay?
Great, thank you so much. And also her legal practice, the website to it is listed in the chat, as well as on the SACU webpage if you need to get in touch with her. But again, you know, another session that we need to have a whole hour to go over because the questions are popping in right now. So let's move on. We have about 5 minutes left, but we want to bring in Harriet Shangarai. And I mean, you've all been a great resource to the community with everything that you share. She's going to talk a little bit more about resources that are available to us. And I really, truly do believe that sharing resources that are available and how you can access them with factual information is how we build community resilience and find ways to overcome a challenging situation like this pandemic. So let's welcome Harriet to the chat. Harriet is a nurse practitioner who also serves as Montgomery County African community, as the Montgomery County African Community Liaison to the county. You know, what resources can we expect in Montgomery County as well as beyond?
Thank you very much, and thank you for having me. So first, I would like to highlight the severity of the problem here in Montgomery County, not only starting here, but rather Maryland. Because right now, as we stand as a state, we have at least 12,000 cases, 380. For Montgomery County itself accounts for 2,404. I'm gonna narrow it down for, with zip code specific, because majority of us reside on those zip codes where we see essential workers, and also part of what you've addressed, that we are the ones who are significantly impacted. So the highest zip codes, including 20904 and 20906, where majority of us reside. I'm talking about the Black and Brown communities. So when we talk about the resources that we are putting in place, as it is now, we realize that education is key, education is important, and I'm here to really request all of you to be the ambassadors and also to join the task force that has been created by the county to significantly focus on these communities, because we need everyone to make sure that this message is getting home. Those of us who are also essential workers, making sure that we're taking it personal, taking it to our communities, and after working hard, when we come home, maybe it's an overshift, you find out that the teenage kids are the ones who are hanging out with a friend, hanging out with a neighbor, and we're overlooking that they can be also a mode of transmission to the other, and the problem continues. So first, after mentioning that, because I know it was significantly mentioned, I want to talk about amount of calls that I do receive because of food insecurities. A lot of people have lost work, no paycheck. So we have this emergency SNAP payment for families. So it is for the state of Maryland, and it is, I'm sure there are other programs if somebody is outside the state of Maryland, that you can apply from Department of Health and other partnering with other organizations here. Here you can also go online for HHS. So that program will provide you with a supplemental nutritional assistance program, will provide you with benefits so that you can get cash, you can get access to food. You can also visit like Catholic Charity Center, and all these programs at this point are online. You cannot visit the center, but you can drop your application on a Dropbox. You can also access it online. You can also call. And at the end of this session, I'll send you all this information so that you can make sure it's placed online and everybody can access it. Other than the food, that is significantly, the most significant that we're all appreciative of the government putting together is the CARES Act that has really significantly helped families, starting from what we see that the stimulus check that is coming to our homes, supposedly starting April the 17th, where families are receiving anywhere from $1,200 to $2,400, depending on your income level. I know that if you're single, you have to make at least less than 75, but if you file tax as a couple, 150 is a cap. So this kind of fund comes to you if you are already registered and you receive your tax benefits online through your bank. But if your bank is not registered, then they're gonna have to mail you a check, and that might take a little bit longer. We are seeing also parents who have claimed their children, let's say you have like 2 kids who are going to college, but you claim them as dependents, they will not receive any money, but those who are not claimed by families, they are also receiving this fund that has been put in place by the government. Other than that, what I'm seeing here significantly is also health access. A lot of people have lost benefits and they're looking where to apply. So started March, Maryland has opened coronavirus access to the Obamacare that used to be there. You can apply and easily get qualified, and that through Medicaid program, you should be 0 to 19 or 19 years old to 64. However, if you don't qualify for that, Maryland Children Health Program also is available. And for the Montgomery County, we have something called Care for Kids. Any child who's born here or any child in this country can qualify. For those adults who don't qualify for these programs, there are a lot of SafeNet programs here in the county. There are a lot of number of clinics that I will list, and I'll share this information with you. So everyone has access to healthcare. But previous speakers, I realized that we've mentioned being able to test, you also have to speak to your doctor first. For a number of those who are undocumented and do not have health insurance, have used MedStar Health, is a video chat. They have waived all the fees. You can have a consultation for free. They will assess your symptoms, and if you meet the criteria that they believe you need to be tested, they will write you a referral and send you to the lab. However, their test might come back within 6 to 8 days. They say they have no control of that, but at least it helps people to be cleared if they need to go back to work and establish that they have tested positive. But you have to meet criteria, and this service is open 24 hours a day, 7 days a week.
Harriet, since you're speaking about testing, I'm going to jump in there for a second.
Sure.
You know, we have a couple of questions from Facebook that we haven't been able to address, but we have one from Christina Banda who asks, you know, what do you do when hospitals or physicians or whoever are refusing to test you? Because some places in her experience are refusing to test people who present with symptoms that are even beyond coughing and shortness of breath.
So, did she go directly to her doctor? Maybe you wouldn't know that, because the doctor has to write that referral for you to be tested. Once you have a referral, you have to be tested, because you only show up at the testing site once you have the referral and appointment. However, I have a resource that has stipulated if you have shortness of breath, as a nurse I'm talking, that is a 911 call right there. You are not gonna stay home and you have shortness of breath or you cannot breathe. If you have to, I'll say show up in the emergency room, but normally they will call. But out of breath, that breathing issue is a 911. So that is, you can negotiate that.
So it sounds like you should be able, as long as you get a referral from your physician, you should be able to go to a testing center and they should test you.
They will test you, definitely.
Thank you.
Thank you.
So we're actually at 4:35, we're already over, and I'm sure you have additional resources that you want to share with us. So I just want to invite all the panelists that are still here, as well as you, Harriet, to stay on a couple of minutes later if you can, and for everybody else who's listening and has the time, just to go ahead and stay on so we can let you finish, and then we can also open up for final discussions before we close.
Sure.
Okay, if you'd like to continue, please go ahead.
I wanted to point out that we're seeing significant increase on domestic violence by 50%. So when you touch about the mental health issues, families are staying at home, staying together, love one another. But at the end of the day, also there have been a lot of conflicts that have been reported. There are numbers that you can call, and this number I'll provide you at the end of the session. Also, I have resources for mental health. There are different names that I can provide you with that are culturally competent, focused significantly for immigrant communities, being able to address. Also, they're focusing on age. We have some for teenagers. We also have number for crisis center that you can call and be able to access issues related to mental health. Another thing I'd like to add is the state of Maryland has put a moratorium in place that no one should be evicted at this point in time. because some of the call I received that people have been evicted during the pandemic, and there's a number to call that is a non-emergency number to the police station. That police would come and make sure that you are protected and you have the right to remain in the residence. So I think information here is power. Knowing that you have the right to remain where you are is fine, is good to know. Even though at the end of the crisis, when everything is lifted, you still owe and you'll have to pay. But right now, everyone should know that they have the right to remain in whatever residence that they are living in. In addition to that, I want to talk a little bit about businesses here in Montgomery County. So businesses that are affected, not only business, but also nonprofit organizations that are affected with this pandemic, there has been a grant that is put in place. It's about $20 million. So I've been reaching out to communities, making sure that they have access to that information and also they apply, because they can qualify up to $75,000 per business, between $10,000 and $75,000 per business, so that to make sure those businesses are able to come back and continue to boost our economies. The only thing I'm seeing as a barrier, it could be possibly language, or we're having a hard time to reach French-speaking communities. I can request you to share any information with the French-speaking communities, but also we're translating this information, making sure that people can understand, and also we're hosting different webinars every other day to make sure that people are well trained, people have access to the information, and they can take advantage of the loan. It's not a loan, it's a grant. Is a grant that is coming out from the county. This is what has been put in place just as for now. But in addition to that, I would say, tons of resources. You know, nationwide, CARES Act also provided fund for businesses, some of the loans that are partially or fully forgiven, and people took advantage of that. I think the money that was put in place already ran out, but they're possibly discussing to make sure that there's additional funding that can help communities and take advantage of that. For those who have student loans at this point, interest has been not, right now they're not, you're not supposed, you can go by without paying your interest, but I have more information I'll share with you. It's been suspended. And also for an unemployment benefit, the benefit has been expanded significantly. So you can qualify for various things, including if you're quarantined or you're taking care of a sick family member, or if you're sick yourself. So know that when you go to apply, it can be frustrating. Maybe phone calls are not going to be answered because of the capacity at this point. The volume is huge, and people are not necessarily built to handle the pandemic. So it's a work in progress, but we're urging everyone in the community to make sure we are informed of your needs so that we can be able to address them. But what I would like to stress a little bit more, our communities, this is such a plus for you to come together. And I truly, truly thank you for this platform, that we have to address our own issues and be very aggressive about it, because a lot of community members, including our essentials workers, are a place to sleep like hotels, but not all of them have a way that they can accommodate or be able to quarantine from their families. So what can we do as a community? I think this is a great opportunity for us to advocate for more resources to come to our communities and see how we can help survive this pandemic. I'll end there for now, and I can share more information. Thank you.
Great. Thank you so much. And thank you to all the panelists. I think I'm going to end it with one more question, and then also give the panelists a chance to add any additional resource that they haven't been able to share. But we have one question that came in from Facebook, where somebody is talking about all the different health disparities that have existed and how COVID-19 is shining a light on those disparities. I know, Harriet, you talked about the different zip codes, and I definitely think that they do reflect the socioeconomic disparities that exist. So what can we do as a group to advocate to minimize the gaps that exist in resources? And how can we do it in a way that we don't stigmatize our community? Does any of our speakers want to try to address that?
I can go.
Okay.
Yes, so from what I am aware of at this point, there has been a task force that has been put together, and they're looking for whether it's a faith-based organization, community-based organization, have truly committed individuals who can be a voice, who can be ambassador and take that message back to our communities and act on it. So I believe just being on that table, you are able to advocate for issues that maybe where I'm living or residing or the information I have does not cover the information you have. So I think coming together whenever there's a communication, whenever majority of what I have received as a feedback, we have a little bit laid behind when it comes to responding for simple things such as the census, because you all know that the census is going on. When they look at the numbers and communities of those who are responding, we always lag behind. So I think this is the time that we all have to be on the forefront and take a very personal responsibility that African community is going to stand up and speak with one voice. Thank you.
Great. Thank you so much. And maybe we'll end it with just one more question to the doctors that we have here. You know, we have somebody in the chat group that has been asking, you know, would you recommend, especially for healthcare workers, that they take, who are more likely to be in contact with COVID-19 victims, that they take things like zinc, vitamin C, vitamin D, black seed oil to boost up their immunity? Do you think that's something that's helpful? I know it's a lot to throw out on you.
I think that it is, okay, so I guess the overall thing would be, so there's always the question about vitamin C and natural things that people do to keep the immune system. And I think that those are good things to do. And I definitely think coupling that with doing your other like disinfectants and all that, that's important. But obviously being healthy enough to do your job is always key. So I don't know if there's any evidence or data in taking extra, but there's no harm in taking vitamin C. So I guess you could take it. So I think it's not a bad idea. I can't give you factual data to say that it will necessarily stop you from getting coronavirus.
Well, thank you for that final advice and final thought. I think I've been saying we're going to end soon a lot of times, but I think we've actually come to the end. And it just speaks to, you know, the need that we have to have more of these, you know, types of discussions. There were so many topics that we really didn't get to dive into as deeply as we had wanted to. But thank you to all the panel speakers, and thank you to everybody for attending, and thank you to SACU for giving us this opportunity to do this.
Thank you.
All right, thank you.
Bye, everybody.
Hi, everybody. Thank you so much. I really appreciate it. I'm Clara. My name is Clara, and I'm from Mozambique.
Okay.
And I got this message through Sister Opper and Marietta, who are in the same, one of the same group, almost of women in the community of Zimbabwe as well as Mozambique. We're very few Mozambicans, but I really, on behalf of all of you, I really, I'm so happy to be part of it. And I do have a daughter who's she's a nurse practitioner. She's a psych nurse practitioner, and then I have a son who's a psych nurse. So I really like them to be part of it next time. And I'll make sure, I wish I would put my daughter's email so that she can be in your, in your emails. But first I need to talk to her first.
Okay.
I can contact the Sister Opper.
Okay, perfect.
Or Marietta.
Yes, you can.
So I think,
Thank you.
So thank you so much.
Everyone.
Thank you,
All right,
from
thank you.
Malawi too.
Okay.
Yeah. It was nice
Great.
seeing you representing us from Malawi. Thank you so much.
Oh, nice to see you from Malawi. Thank you.
Okay.
All right, thank you, everyone. Feel free to email SACU. We listed the contact information in the chat, and you can go to the website. There's also a contact us button. So if you have suggestions for future topics or just the thoughts that you just shared, would love to hear them.
Bye, Opper.
All right, everyone.
Thank
Have a
Taco.
Oh my gosh.
Miss Barrie, are you still online?
Yes, I am.
Okay. I just had a question, and I realized that your practice is limited to immigration law, but I was just wondering if I could pick your brain on something in light of the fact that a lot of those fatalities that are happening in like long-term care facilities and nursing homes. And at the risk of, bringing back the horrors of law school, I just was wondering if I can get your thoughts on whether or not you think, given the uniqueness of a pandemic, do you think there are going to be any non-traditional defenses that this establishment will have in light of potential tort claims that are going to be brought by the survivors of the deceased? Sorry, I cannot hear you. I think your mic is on mute.
So you mean the agencies, or you're talking about individuals?
No, I mean the individual. So I mean, typically, I guess my question is: there's going to be some negligence claims that are going to be brought because people are dying. But then, given that a pandemic seems to be unique than every day slip and fall, I'm just curious as a lawyer whether you think there's going to be any sort of like unique defenses that the facilities can bring in those kind of cases.
So it's funny. So I don't practice tort law per se.
Yeah. Mm-hmm.
So this is not any sort of legal
advice
or whatnot, just to, you know how it goes.
Yeah. I hear you.
Just to give that little, before I say anything. So it's funny because I was having sort of similar conversation with someone earlier today, in fact, about people being able to bring the store claims, not just the homes where all these things is happening, but to the extent that, you have this statewide thing about wearing the masks. And someone goes out to get sick from someone who was not wearing the mask. So the issue is going to be, can they then file a suit based on that? So logically, you probably can, right?
Yeah.
Because you're exposing someone to a disease after you've already known that it is a danger to that person, and you did not follow proper precautions as directed. So conceivably, you can. Some of the issue is going to be proof, right? It's being able to show that this, whatever it is, originated from here. So people in nursing homes who have lost loved ones, people in those sort of facilities, I think at the end of this, we will see probably attorneys who are interested in tort law, this is probably a lot of times I don't talk about those things because it just seems so cold. It just seems so cold, and people are still grieving over their loss of life. But with that question posed, I would say that probably yes, and there's going to have to be an imagination on how you make your arguments, right? But most legal policies come from precedent setting, right? So something has to have happened for a court to make a decision, and that court decision a lot of times will translate to policy. So this may be an opportunity for something like that to happen, where something new comes out of all this and people say the government knew that A, B, C, and D was happening,
Yeah.
and you did nothing, and in fact, you did the opposite. And so therefore, my loved one was lost because of your negligence, and therefore you owe me whatever.
X amount.
And then the court decides that, right?
Yeah.
And those kind of cases, whoever wants to get into those will have to realize that 9 times out of 10, they are going to be in it for a long time, because you're going to go from level to level.
Okay.
You're going to go from the lower court and keep going all the way up.
Yeah.
Then you're going to have to find somebody to take you up to Supreme Court if they even take the case, even if they take the case.
Yeah.
Especially if you sue the federal government.
Yeah.
Because then I was just gonna, but it's an interesting conversation. We can have that if you want.
Mkutano umeisha.
So we can have that.
Okay, yeah.
Oh,
I'll
thank
send
you
an
so
email.
much. Umeshakula?
So we can get in touch and have a conversation.
Sounds good.
Outside of this, whatever.
Well,
Okay.
thank you so much. Yeah.
Yeah, we can have a conversation. There are many other conversations to be had. Trust me. Yeah, there are many other conversations to be had. Not just in that, but even in education, because I also do special education law. So there are many other conversations to be had at the end of this unfortunate pandemic.
Gotcha.
Okay.
All right. Well, thank you so much.
No problem. Bye, everybody.
Bye, thank you
No problem.
for your participation.
All right, thank you very much.
Bye.
I thank you for joining us, everybody.
Thank you, Sitinga.
Hey, Fakula, thanks for joining us. I saw you. It said Fakula Canada. Wow. Representing.
No, this was great. This was great.
Oh, I'm glad you liked it. Yeah, we're hoping to do a follow-up based on the feedback that we get.
Yeah.
So I think we're having issues with time because I think there was so much information and so much people wanted to say still.
Yeah, for sure. Yeah. Okay. Anyway, you have a good one.
You too. Bye.
Bye.